And watch the beginning. So first of all, I want to thank everyone who's attending for watching. I want to thank everyone who is watching the recording for taking the time to listen to us. And most importantly, I want to really thank our guests, Dr. Lavan and Dr. Sherry, for showing up here today to share their wisdom. And my name is Indre, and I've been thinking what really is my role with Meaningful Paths, but we met with the founders of Meaningful Paths quite a long time ago, and I've been a huge supporter ever since. And I think it's an absolutely wonderful platform helping people really take their well-being to the next level and covering all of the aspects of it, not just the health side, but also the financial side, the mindset, the learning, getting their family members involved in it as well. My background is in finance, and I'm a huge supporter of financial education for women. So that's something that's to come on Meaningful Paths, and something I'm also thinking about is including children when it comes to learning about finance, but that's for another day, for another topic. Today, we're really here to talk to two wonderful doctors sharing their knowledge. And the topic today is really to, I guess, uncover and discover everything we need to know about ADD, ADHD. And this is something, since I've had a child, and it's something that comes up far more often. You hear parents talking about it. You find parents being lost in the whole kind of scheme of what is it? How does it work? Where does it come from? What do I need to know? How do I need to deal with it? So I think without further ado, I'm going to invite Dr. Lavan and Dr. Sherry to just introduce yourselves very quickly about, what you've been doing, what your story is, and then we can kick off with some questions. So, Dr. Sherry, would you like to kick off our call?
Thank you. Yes. I hope you can all hear me okay, right?
Yeah.
I'm a clinical psychologist and a clinical neuropsychologist. My office is based in Connecticut. A large part of my work over the past 30 years has been with diagnosing ADD, ADHD, as well as developing treatment plans and accommodation strategies for young people with attention deficits. And one of the things that I always try to explain to parents as well as students that I work with is that ADD rarely comes by itself. And we're going to talk about that today with Dr. Lavan. And I've got great questions for him because I'm coming today as a psychologist and neuropsychologist. So one of the things that I spend a lot of time on is diagnosing and making that differential diagnosis and trying to figure out, well, what else might be impacting this young person, as well as the attentional deficit. So I work in partnership with physicians, pediatricians, and psychiatrists. Even though I'm not a medical doctor, I am a partner in care. So with that, I'm going to now give it to my colleague and friend, Dr. Lavan, to explain.
Thank you so much, Dr. Sherry. I'm actually in a similar position, actually. I'm not the one who diagnoses, but I'm kind of the partner in partnership with a psychiatrist. So I'm Dr. Lavan. I'm actually a general practitioner. I think in America, they call it family physician here over in the UK. And I've been doing it for about 15 years. Absolutely love it, seeing all walks of life, from babies, we say cradle to grave. So a very fulfilling career. But in terms of in the last few years, I've almost felt there's a group, we call them the underserved population. This is a population where groups like ADHD in the UK, as well as, transgender community, as well as people with certain conditions that don't really get the time or the effort put in, actually. And they may be smaller groups than the general, but I'm finding a lot more fulfillment in seeing those patients. And we call it almost like quick wins, especially in our ADD, ADHD population. Here in the UK, the National Health Service is a wonderful, wonderful system that we have. But unfortunately, just due to the demand, some of these patients aren't getting diagnosed. We have waiting lists of about 3 years on the NHS for ADD, ADHD. Now, you think if they're picked up quite late, and when I mean late, I'm talking kind of teenage years, they could finish school and not have their foundation years supported by either with a psychologist or with a physician to start medication. So I really wanted to do something about that and be part of it. And my aim was to work privately with a physician, so a psychiatrist, child psychiatrist, learn the trade as best as I can, and almost try and bring that into the NHS to try and get speedy referrals and impact. So I'm really looking forward to today learning what we do across the pond, but also with Dr. Sherry, who's got far massive knowledge compared to us. But yeah, looking forward to it today.
So maybe I can throw out the first kind of, I guess, simple, but also the most complicated question. What really is it? Is it a psychological disorder? Is it biological? If you can shed some light on what that actually means when you're diagnosed with ADD, ADHD.
Sherry, shall I let you go first? Or?
Okay, I'll go from my perspective. So thanks to neuroimaging over the past 25 years, our understanding of attention deficits has grown. And it's really very much neurological. It's not in your head, but it's in your head. Okay. It's very much also correlated with family incidents. So oftentimes you'll see that attention deficits can run in families. It's not unusual, even though it might have been undiagnosed in a parent or an older sibling, along with other problems that might come along with it, just different types of learning challenges or reading disorders. So I very much look at ADD, ADHD as biological with a huge psychological component to it, because it involves how you think about the world, how you act upon the world, how you process the world, and how you're going to learn, even how you communicate. So it's a learning difference, it's a neuro difference, but it's not something that is your fault. It's not that you're not trying hard enough. It's something that's a part of you, makes you who you are. You have challenges, but you also have strengths if you have an attention deficit. So with that, I'm going to ask Dr. Lavan to comment.
Yeah, I 100% agree, Sherry. The neuroimaging has been a game changer, I think, in that sense. Even the way we used to treat depression and anxiety, now with the neuroimaging, where we generally know that these chemicals, what we call the neurotransmitters, are actually potentially lower, we can actually bring those up. And similar with ADHD, we found certain parts of the brain, the areas we call the cerebellum and the prefrontal cortex, theoretically are actually smaller compared to others. And that's not to say, exactly like Dr. Sherry is saying, they're in any way inadequate. They actually have some wonderful skills, and I'm sure Dr. Sherry will share some of these experiences, but some of the patients I meet are absolutely brilliant. They are, sometimes I speak to them and say, please remember me, because one day they're going to be famous, running countries, doing some wonderful things. And it's what's heartbreaking is because we are not able, especially in this country, to provide that care as well as we'd like. There is a group, or there is this population that are losing out as a result. So I think with the neuroimaging that we have now, the understanding we have, the idea that Dr. Sherry was mentioning about the psychological aspect, we find a lot of the time, unfortunately, these poor children, they're almost losing self-confidence as a result of it, because actually in those first few years, they're not performing as well. Teachers and friends will say, oh, you're disruptive, you're making a problem with the class. And that can actually have, if someone was telling me that year on year on year, you're a troublemaker. And when I look back at my schooling days, I can definitely tell you there were people in my class who were we were in very good schools, but were performing poorly. And I can definitely tell now they probably had ADD and ADHD. And previously, our idea of this was, it was almost like a flippant comment. Oh, they must be hyperactive. They must have ADHD, which is terrible. Looking back now, it's sad to think that when genuinely they may have actually had something that we could have done. So I think we're in a much better place now. There's a lot of education. People are aware. And we know now, as Dr. Sher was saying, there is a genetic component. I sometimes in my waiting room will leave kids waiting with their parents. And I've had cases where mothers will look at the other child and say, oh, that's interesting. And they start communicating with each other. And there'll be undiagnosed mothers or fathers who will come to me and say, I know you're seeing my daughter, but I think I have ADHD. Is it genetic? And you'll say, oh, yeah, actually. And you hear their stories, they're 40, 45, haven't been diagnosed. And they say, God, I really wish I had, because I never understood why. And that's why I think Dr. Sherry and myself really want to make this kind of awareness a little bit more so people can talk about it.
So Dr. Sherry, I'll go back a little bit to what you were, saying about it, and what Dr. Lavan just confirmed, that it is genetic. How early can it actually be diagnosed? Because do I assume correctly that if it is in a way genetic, you're basically born with it? Or does it develop later in life? And how early can you pick something that up? And how do you even diagnose as a parent as well? When should you seek for that diagnosis, rather than just assuming that your child is a little bit hyperactive, is a little bit, more active than other children?
That's a great question. So, like many other issues we see in young children, I look at attention problems and hyperactivity as a kind of an alarm system that's telling me something else is going on or something's not right. So it's alerting me to something. So, it could be that the ADD is part of another learning difference or part of another sequelae of symptoms related to another disorder. It could be another type of developmental disorder. I've also had children that initially were brought to me because they thought they had attention problems, and they actually had a hearing disorder. And that's why they weren't attending. Or they had an auditory processing disorder, or they had another disorder that may have been on the spectrum of autism, or they had a reading disorder. And it wasn't specifically ADD, but they actually had something else. But the parents brought attention to the problems with focusing or listening or hyperactivity. So that's what first came to my attention, was the attentional problem. And that's how we test and do a very thorough evaluation to determine what else might be going on. So, one example of something that's genetic that goes hand in hand with some attention differences is dyslexia or reading disabilities, for example. And you often see these two pair up. Okay. And it makes sense. And it's not just because the attention problem causes the reading. No. And it's not just because the reading causes the attention problem. It's because biologically in the brain, the area that is involved in processing, much like a processor in your computer, is not working as fast as it should. Okay. It's sort of like having an old DOS system and you want an Intel processor. Okay. So that's one of the things that we look at is it an underlying processing disorder? Is it something else that's going on? So I've seen children come in as young as 1, where the mom notices something's just off. And oftentimes this is a mom that has older kids and they notice that something's off. But I would say, and this might surprise you all, but I'd say 90% of the moms who've come to me with an intuition that something was off, they were right. Something wasn't right. It's not that they were being hypervigilant or too afraid. Something kicked in and there was indeed something that wasn't correct in that developmental trajectory.
Very interesting. And Dr. Lavan, I think I want to ask you, if a mom finds herself in that situation where exactly, being a mom, I've kind of gone not with AD, but just generally my child being unwell through that process where I knew something is not right. And, I kept asking and pushing and pushing. And when I got the blood test results finally done, things showed up. And luckily we got treated and everything is fine. So in the UK, because I assume a lot of the listeners and those who watch back will be in the UK, what would you suggest? What would be really the process of, getting it diagnosed, getting, you know, somebody to look at it? Do you go to your GP? Do you go directly to any other organization? If you feel that something is not right, what should be the steps that you take?
Absolutely. Yeah, very good question. I think in the UK, your general practitioner, your family doctor should be your first line of support, even as a support network, because actually the hope is we have enough experience that we can provide some guidance. We're not definitely experts in it. Of course, I've read more about ADHD because I'm working on that part, but a lot of my colleagues, they'll be brilliant at different parts of medicine, but may not be so familiar with ADHD. And it is what Dr. Sho was saying. It's the intuition that the mother has. I take that so seriously. When a mother brings in a child, if she says, I know my child, this is not them, I take them much more, you know, with so much more value than any other patient I'll see that day, because they know their child. I know, you know, as much as I'm a father, I know my wife is much better at picking up these signs. It's those subtle things that we don't pick up on. And interestingly, like Dr. Sho said, it's actually about having siblings as well. So some of the earlier ADHD diagnoses we pick up on is they would have had sisters or brothers, and they quite quickly will say, oh, my oldest one was diagnosed at 14, but I can see the traits at that 5-year-old, and we'll jump on. Here in the UK, there's this balance about labeling. We know how important labels can be, especially if you can pick up early exams and the way, you know, for autism, for example, if the family are aware, the way of managing it is so much better if they are aware. The difficulty is obviously if you label too early, does that provide a complex for the child? We're in this really difficult bubble here. So in this country, anyone aged between when they're born to 5, the general care is under the pediatricians. When it is in things like ADHD, autism, or any other neurodevelopmental. The guidelines are after 5 years old and upwards, a CAMS or child and adolescent mental health specialist, i.e. consultant, would see. But the port of call, the way the NHS works, it always does go through the GP first. And what we do, I used to kind of sit there and write the history. What do you think is going on? So they do this, they do that. What I tell the mother now is you write on an A4 everything you just think is not quite there. So maybe it's something subtle like what they eat, like Dr. Sho was saying. There may be other things. Maybe we're going to diagnose ADHD, but maybe we're not. Maybe it's something else. And I write that huge list, and I actually formulate that in my own words and refer that on. And someone on the other end, specialist, will read through it and say, oh, this is looking like it, and we'll see. I think my big problem at the moment is when that happens, that next stage is where there's this big delay, which I'm not so happy with. And that's where, you know, more funding needs to go into the NHS on that area. Or I do sadly tell some families that even if it means paying for that initial diagnosis, because it's a very convincing story, I know it's a lot of money, but at least get that first part in. Once you've got the diagnosis, we can bring you back into the NHS and support you with psychology, support you with medication, add nutritionist, dietitian, all of that can work in.
And what is the process for diagnosis? What does that mean? If somebody comes in with their child, are there specific tests done? You know, given that it's neurological, I guess, you know, a blood test is not going to tell you that. So what can one expect in terms of how do you diagnose it?
Well, there are certain criteria for ADD, and that is what we look at. Does this child meet the diagnostic criteria? And they're very laid out and very specific of what you need to meet for appropriate diagnosis and then for finding the appropriate treatment. When someone comes to me, for example, and especially if it's a very young child, I do a very thorough neuropsych evaluation, which includes measuring auditory attention as well as visual attention, their organization skills, other cognitive skills like their language understanding, their ability to speak and express themselves, their memory, their short-term memory, then delayed memory, their ability to maybe do 2 things at once, or their ability to shift from one task to the other without getting totally derailed. So it's a very thorough process. Along with that, I also do early reading skills, or what we call pre-reading skills, that children develop before they're even in the kindergarten year, to see how they're coming along. So it's diagnosis, but then it's also looking at what possibly else might be going on.
And once diagnosed, assume, you know, not every child who's diagnosed with ADD, ADHD is exactly the same. So how is the treatment decided? And, you know, does that mean that if you have ADD, that's it, you have to be under medication for the rest of your life? Are there different forms in terms of severity of the disorder, and how you would treat that depending?
Should I jump in there,
Why
Shay?
not?
Yes, please.
So yeah, absolutely. Like we know with most conditions, every patient's different. And you can talk about any medical condition, and you may have a rheumatological condition or a bone condition, but the way that person experiences it, their way of managing it is going to be different. And then the way they present. So absolutely in ADHD is very similar. When we, as Dr. Shay perfectly explained, that is very similar to what we do. We have also something called a QB testing, which I don't know if Dr. Sherry has, but it's about responding times, and it's a 15-minute test, and it helps with that side. And it doesn't depend on your maths capability or your reading capability. And here in the UK, our physicians, they do quite very similar to what Dr. Sherry does, a very thorough, you know, we call collateral history as well, asking what mum thinks, asking what school thinks. And you do really get a good sense of this child most likely does have ADD or ADHD. And when we go towards treatment with psychological help, it is a question of, we are looking for this, we term it here in the UK as the night-day effect, or putting on the glasses, where you literally can give a medication or do a treatment, and it should literally game change their life. And that's what I love about what I do with ADHD. It is that, you know, some of the grateful patients, they will just say, you know, their life was, you know, failing exams. I've seen cases. I've got one young girl who's at Cambridge now, and you know, she was, you know, sleeping around with the wrong crowd. She was disruptive at school. She's now flying in Cambridge, and it's heartbreaking. When you hear her story, you get, you know, you well up when you hear how difficult her time has been. And I say with these patients, they are the most fulfilling patients, where you can give that game-changing approach. And when you listen to the story, it is a question of what is going on in their lifetime. Say, for example, they're at boarding school. We actually think, oh, they're at boarding school, so they need a long kind of medication that covers for the whole day. They do work after 7, 8 o'clock. So actually giving a 3-hourly medication to kind of help is going to be a waste of time. But then similarly, on the other end, I've just spoke to a couple of patients who are at university now. They don't need a 12-hourly medication because, you know, they wake up casually. They've got lectures at kind of 10 to 1. So we tailor make it to give them, you know, just for that. So why don't you take one of these to just cover? And why unnecessarily be taking daily medication? I'm a big fan of, although I appreciate medication is there, we just don't want to pill pop all the time. We know there's a purpose. We know it helps, just like glasses work. And similar to how glasses are, that lens sometimes can lose its effect. Say, for example, they gain weight with certain kinds of medication, or sometimes we get some cases where there is a young girl, very slim, who's a 14-year-old, who has a massive dose of ADHD medication, but there's a big, strong lad who's 18, who's actually taking a very small dose. It does vary, but we do really look in, we do hear in, and we in this country really should be following the nice guidelines, where we should be checking these patients twice a year, because those twice a year, anything can happen. And what we don't want is a patient to be put on an ADHD medication and not seeing a physician or psychologist or anyone in the next year, and staying on that same dose and actually slowly performing less and less. So yes, every patient is definitely different, and it's very important to treat each patient differently and tailor make their lifestyle, as well as their build, as well as the way their outlook is of life, with medication and psychological support.
I just wanted to add something to that, which Dr. Lavan said is so important. So we do baseline testing, as we explained, with the neuropsych evaluation, where we have computerized tests. We also have self-report inventories for older children, parent report inventories or surveys that are standardized, and also inventories or surveys for teachers that observe behaviors. And these are really important, not only for diagnosis, but to see the efficacy of the medications. Makes sense, right? So we want to know if they're really working, if this medication protocol is appropriate. And so oftentimes I'll retest a patient, will come in and say, now we're going to put you on this computer program. It's a little bit different, to be honest. And we're going to see, is your response time, is your listening better? are you paying attention better over the course of 20 minutes than you were without medication? So it's not just a guessing game. The good news about attention problems is that physicians and psychologists have been studying this for decades. So it's not only a science, it's also an art form in treating attention deficits.
That's very interesting indeed. And is a diagnosis, when you are diagnosed, is that really for life? And, you know, when you talk about medication, does that mean that the patient will always have to take the pill? You will always have, you know, to be observed twice a year or however often? Would there ever be a time when, I don't know, it reduces, it improves, and maybe you can reduce even the medication, you know, rather than increasing it over time? How does it develop?
Yeah, I think in terms of, especially in this country, Dr. Shay, what we have is life changes, the maturity of the brain changes, the way they manage changes. You think of, you know, some of these, I've got a few 40, 50-year-old patients who are being diagnosed with ADHD. They've come to me and read more, being aware, Dr. Lavan, I think I've had ADHD, but what can I do? We still get them diagnosed. It's important for them. It's almost like a closure or some reassurance that, God, now it makes sense why I struggled. And if you think they somehow managed, I've got some guys who are flying who had ADHD. So it's not so with the brain development, what we find with a lot of these children, they find their way, they cleverly find their way of managing. And I think the important thing is, if they are medicated relatively early on, that stress of worrying about kind of that concentration is one less thing to worry about. If they are an ADHD patient and they're constantly worrying and thinking about it and not focusing, they don't have time to kind of allow for that development, that maturation to take place. Once that side is better, I get these wonderful stories of, and I find it a lot with the guys, 18-year-old, 17, 18-year-old chaps who kind of go to university. So remember, our training up until then at school is subjects you may not like, maths and history and geography. They may not be very keen on it. They're forced to do it. They get to A level, it's getting a little bit better. They're choosing subjects they like, but then they go to university to study politics or medicine, something they're passionate about. All of a sudden, they're doing subjects they love. They're now a lot more mature. They're kind of hitting the gym, eating well, you know, taking the right vitamins. They're really looking after themselves. And I find actually they're the best patients. We are, like you said, dropping their medication doses. So one of our, what we call 12-hour medications, Elvance, high doses, say 70 milligrams, we're actually dropping to 50, 40. And one of the chaps I spoke to about 3 months ago, he's off it. He says, Dr. Lavan, I don't see the point because I'm loving the subject I'm doing. He has it as a backup. He has kind of a short acting on special days, maybe an exam or something, he would take it. But otherwise, he's actually flying in that sense. So no, I say to a lot of the patients, because that is one of the first questions we get asked, is it like a life sentence? Do I have to always take it? No, actually, we're a lot more accommodating now, and we're finding these clever tricks. And I'm sure Dr. Shay will share some of these, but these kind of added things that we can do that don't always have to be medication related. And the psychological support is so important. Sometimes we find in the younger kids, they struggle to get that communication going. But as they get older, they're much more willing. They want to get it. And we sometimes introduce psychologists at 16 years old. We get some really lovely people in London who will come and support us. And with that combination, that they do wonderfully well. So yeah, absolutely, I agree. It never has to be a forever increasing path. In fact, I see most of the time we drop down, in fact, stop sometimes.
Very interesting. And I want to pick up on something you said about that one child who said, you know, his diet is on point, he's working out, he's doing all of these things. So how important diet and lifestyle is in managing such a condition? Maybe Dr. Sherry, you have
yes, absolutely. So I've been really looking at a holistic approach to treating ADD for 25 years now. So diet's very important. So for example, and there's also diagnostic too. So if you have a child who is craving sugar all the time, loves those stimulating drinks, that is a heads up for you that something's going on, okay? And so we want to look at diet because the amount of sugar, as well as corn syrup that's in our kids' diets is just way too much. And that can affect their attention levels. The other thing we look at, and Dr. Lavan and I have been discussing that, is nutrients. Oftentimes we have kids that are deficient in nutrients like vitamin D, in magnesium, and these are just two of the nutrients we look at. B vitamins that should be in their diet. They may not be getting enough of that, especially in the UK. The vitamin D is very important. The other thing that is both diagnostic yet should be limited and watched is the amount of gaming that your child does. Gaming is a type of a stimulant. It can have a stimulant effect on you. It can impact your attention. It can impact how you process information in the developing brain that we know of, and also your sleep patterns, right? So if your child is up on social media late into the night or gaming and finds it difficult to go to sleep, it's going to make their attention deficit even worse.
Wow, that's so interesting. So there's a lot of other factors that not only influence it, but that families can do apart from medication to basically help their children manage the disorder in a better way.
Yes, and exercise is a big part of that also.
Mm-hmm.
But I also just wanted to pick up on something that Dr. Lavan had said, which I think parents should know about. As kids age, actually, I have found undiagnosed kids will self-medicate. So as they go into the teen years, if they're undiagnosed, and that's a risk you take by not addressing the reality of your child or your teenager's problems with attention and really get to the bottom of it. These are kids that might seek out ways of giving them what they need, whether it's smoking, having lots of sugary drinks or energy drinks that are on the market, or doing drugs or thrill seeking. So there is a lot of dangerous behaviors that kids might engage in if they're not appropriately followed or medicated.
Wow, that's very interesting to know.
We're a bit delayed on that show. We are seeing that. So I work in two areas. One, kind of a well-to-do population, which we don't see much of. The hope is the diagnosis is quicker because they can afford it. Sadly, I work in another area, low socioeconomic population, and exactly like you said, I didn't know that phenomenon, but it's showing up now where we're seeing a lot more of it, and actually it's late diagnosis of ADHD. So it's interesting. If you asked me 5 years ago, I would probably said we don't see it at all. But certainly seeing that in that kind of poorer population, that's very interesting.
So yes. As a parent, would you say what would you say are the, I don't know, top 5 signs to look out for in younger children versus teenagers that should get you concerned and should get you to seek a diagnosis?
I think it's interesting because the obvious things that kind of you would assume anyone would pick up on, that kind of typical thing that we say, running around and smashing this and doing things, that although it's there and we get cases, it's this inattention I kind of feel is the subtle one, the one that really gets missed. And they find that a lot in some of the females, not to say that the males are always worse, I should be representing the males, but with the females, it is that subtleness, that inattention that, they're probably, not performing to the best of their abilities. And school might pick up on it. And if you've really got what we have in this country called SENCO, kind of the support network for that, if they can pick up on it and say, oh, something is not quite right here, that's great. Because I have to be honest, even as a parent, with my kids especially, I don't want to particularly push them too much. Whatever they can manage, even sport-wise. You'd like to think like that. So I think it's the school that are the key. And I do find with patients themselves, I speak to some of them, and they don't see even if the medication or not makes a difference. But you actually speak to the parents, and they say, "Gosh, what a game changer! Medication is fantastic." But even more, the school reports, the headmaster saying, "God, I wish your child, I could have 30 of them in my class," whereas before it wouldn't have been the case. So I think school is the ones that pick up, but it's this attention, these subtle things. The typical kind of fidgeting, running around, doing things is not how it used to be. It's that short-term kind of inattention span, the subtle kind of forgetting things. We joke about how we all forget things, but this is quite obvious, forgetting things, disrupting, kind of when there's a set of tasks and, oh, I don't want to do this task, but do that. Going further into it and asking, and I think this quality of life element is quite important. When these things start to impact quality of life, people need to take note. There's a lot of conditions you could argue. I mean, I could have a pain in my hip, but actually, if the pain in my hip is manageable, I can kind of go to the gym, I can do things. There's probably a point saying, look, if there's nothing sinister going on, let's crack on and manage with this. But I think if it gets to a stage where, you know, you're a person who's actually struggling, or, you know, in a class where actually they're almost failing and people are picking up on it, someone needs to approach that. You know, tuition and spending time afterwards is all helpful. But if you're finding, despite all of that, they're not quite getting it, don't be flippant and say, oh, they're just not a very intelligent child. Or I think some effort and time needs to be put in, and these things need to be picked up.
Absolutely. I think if, you know, when it starts to affect the quality of one's education, their ability to learn, their ability to function in school, that needs to be addressed. And that is really difficult if someone's inattentive type or predominantly inattentive with their attentional disorder. It's not going to be as obvious. And especially this gets missed a lot with girls early on, because they might be seen as well behaved, but they're just not following along, not paying attention. The other things that are sort of interesting and more subtle features that parents should know about, you know, is your child having difficulty playing with other children? Are they impulsive? Do they not take turns? Are they resistant to playing games that involve structure? Do they tend to want to be on video games all day rather than playing normal childhood games or childhood games with other kids? Are they resistant to reading or being read to? They don't even want to sit and listen to a story, that type of thing, you know. And it is hard, you know, for a lot of young children are under the demands of a school day that have less hands-on experiences now than even when we were kids. And the school day itself demands a lot of attending to or listening to and sitting still. And that's not what kids want. Kids want to act upon the world. That's how they learn. So I think it's, you know, in partnership also with the school and figuring out what works best for a child. I have kids, you know, whose parents or teachers complain, well, you know, he's not doing well on his math test. And I said, well, what time does he have math? And he said, well, 11:30 in the morning. I said, well, he's been in school for 2 hours or 3 hours. He hasn't had a break. He hasn't even had a snack yet. And you expect him to pay attention to learning his times tables. And he's, you know, he's been sitting there for 3 hours. You couldn't do that without having a cup of coffee, right?
Yeah, absolutely.
Interesting. We actually have a question from one of our attendees, going back to something, Dr. Sherry, you said before, about, you know, kids spending too much time gaming or on their phone. And the question is, what would be the tip that you would give for a parent to help manage their children who do have too much video gaming or phone exposure?
Right. So the average time per week that an average middle school to high schooler spends on social media now is equivalent to 1 day per week. So 24 hours.
Wow, that's a lot. That's shocking.
Yeah.
Wow.
So, you know, you look at that and that's about 3 hours a day or 4 hours a day. So you're looking at an average middle schooler spending 3 to 4 hours a day on their phone. So it's doing either, you know, Instagram, Facebook, TikTok, or some other, you know, Discord is one which is popular with the boys. So you look at that. So you know, monitor that. Have a phone basket in the home so they know early on before you give them the phone that the phone basket, and these are the hours that we expect our phones to be in the basket, including the parent. So no phones at dinner time, for example, no phones during homework time, and keep the phone in the phone basket. and have very set limits. So you can actually turn off your internet at a certain hour to do that. If you find that your child is gaming to the point where it's disrupting their schoolwork, impacting their school functioning, impacting their friendships, where they have few or no friends because they prefer gaming, then it's time to seek help.
It's actually quite shocking and disturbing to find out the statistics. And, you know, if you think about it, I guess the future is it's only going to increase, right?
Well, it's become worse during the COVID pandemic because the kids have been out of school and the kids have been home. Okay. And that's, you know, in addition to the online time they spend schooling or doing their homework, you know, so a lot of kids might say they're doing their homework, but they might be on their phone or they might be on social media on their computer. I've never had my child be isolated during homework. I've always watched my child work at the kitchen table or the dining room table. Not that there was a problem, but I just wanted schooling and learning to be a part of the nurturing practice in the family, that learning is nourishment. So I've always had that. I've always embraced learning to be in a family atmosphere and not isolating. But a lot of kids are isolated, and you have to start these conversations very early on.
Wow, yeah.
We could do a whole other webinar
Yeah.
on that, right, Dr. Lavan?
It's very good. I need
But
to
you
follow. I have you know, young children, 5 and 3, and it is a worry. I mean, because the easier life or the easiest option is always just whacking an iPad. But you know, it's very important. You know, it's that thing about planting the seed. If that becomes the norm, that whacking an iPad for, you know, lunchtime, dinner. I mean, we have pediatricians who are saying, you know, even the sensation of tasting food, they don't even learn that sensation because they're watching a screen sometimes. And it is that kind of, you know, whether you set up in a reward system or minimizing it in some way, that's the only way to do it. And if you don't do it early on, you do get to this situation. We struggle with some of our teenage kids now. The mothers are desperate, asking for support and advice from us, but not in a bad way, but we've kind of passed that stage there. It's very, very difficult to challenge. And, you know, and sometimes the only way to kind of communicate that through is the sleep element of it. I do talk a lot about the sleep side because it's so important. And that sleep, if they're not sleeping as well, it's going to have a negative effect on their ADHD. But you know, it's great, show that that idea of embracing knowledge in that environment where you're together. That's what I envision. I hope with my kids, they're only 5 and 3, but I'll always have work after work to do. But I love it to be in that table where we're kind of all talking and jumping in. I think this isolation, I know I kind of used to go to my room, but the temptation is that I know we didn't have social media then, but we still had the starting of internet, and, you know, it was a World Wide Web. Wow, you can just look at anything. So yeah, it's wonderful to kind of, I think those kind of nuggets or gems of encouraging, you know, learning as a group, as a family is a very good tip.
Yeah, there are some really good study tips that are actually available on Meaningful Pass, that my daughter Caitlin wrote on strategies for learning how to learn and studying more effectively, that actually work really well for students with attentional deficits. And so when you have an attention deficit, I think one of the benefits is that you actually learn study skills that are good for everyone. That you are going to learn strategies. You're going to have this opportunity to learn about yourself in a way that other students can't learn or don't learn about themselves. And there are very clear ways based on research on how kids with attention deficit learn differently, how they see the world differently. And I'm just going to give you one little hint so parents don't get upset with their kids. Oftentimes you'll see a messy desk of a child or even an adult with attention deficit, right? And it's not that they're so disorganized, it's that oftentimes they want to see everything in front of them, and that's how they organize. They need to keep track of it that way. So you might see their entire desk with piles of things, and it's not that they're being messy on purpose, it's that they like to see things all in front of them. Now I have strategies for teaching young students with attention deficits how to learn and how to write a little bit differently than what they learn in school. I'm happy to do that at another time.
Oh, wonderful. Fantastic. It's great to know that there are resources out there already. So for anyone watching, make sure you check out the Meaningful Paths website and app and get hold of that information. We just had, following on actually on what you said about screen time and all of that, we have another question from an attendee asking whether something like meditation can actually help people with ADD.
Lavan, do you want to take that one? Because
Yeah,
I
I'm
can
happy
take
to.
that
Yeah.
one too.
Yeah, I have to be honest, the research behind it, I don't have it to hand, but I know even, I mean, we talk about ADD and ADHD, but for a lot of conditions, we definitely, push on meditation. I know a lot of the patients I have, the 17, 18-year-olds, they all come to me and say, I've started meditating and I've found that has been really helpful. And they feel really guilty, but they say, I really don't want to be disrespectful of Dr. Lavan, but I've actually dropped my dose since doing the meditation. So this is anecdotally, I'm seeing very sensible patients who are finding their own ways. Yoga is another thing, kind of the stretching, the exercises. Sport, as Dr. Sher said earlier, is massive. We didn't go into it in too much depth, but I've seen massive improvements on there. Even if you take ADHD for that one patient, you could potentially play sport all day where they don't need their medication, get so tired that they actually fall asleep afterwards, but you're getting all of that. You're getting the cardiovascular benefit, but also you're sleeping well as well. So I definitely say, meditation, and I say this for all conditions, that focus. I know I've done a lot of it over the last 2 years because, work schedule wise and life wise, to the point I do generally feel, highly anxious, get to a highly anxious state. And they kind of call this as high functioning anxiety, where you take on a million projects, but you love it. But then when you get to it, there's almost a nervousness where, I did feel, even 2 years ago, if there was this opportunity, so meeting Dr. Sherry, doing this talk, there was 2 years ago, was as excited as I would have been on the day, there would have been this huge overwhelming anxiety. And I think actually that kind of meditation to start the day, it's almost like you complete a task or challenge. It's already tick box, a positive start to your day. So not only is the process wonderful, but it's a quick win, just like going to the gym or swimming before 6, 7 o'clock. You're already ahead of the game for the general population of the country because you've already got this quick win. And I think those kind of strategies are very sensible for the patient to come up with themselves, because there's that kind of, empowerment, ownership of their condition, that I've learned this, I've offered this, I'm going to tell now Dr. Lavan, and now he supports it. That's a wonderful thing. But yeah, I definitely, stand by meditation. It's not kind of a wishy-washy, as we term it here in the UK. Mm-hmm. It's a definite strategy, no question.
I do meditation with kids, and I sort of have a rule of thumb that don't expect your child to do meditation for more than a minute per their year. So let's say they're 8 years old, expect about 8 minutes for mindfulness or meditation practice. 5 years old, 5 minutes, that's about realistic expectation. There's, energy work that you can do with kids. There's ways of explaining it. They don't have to sit on the floor crisscross applesauce. They can have, different ways of meditating and being mindful. There's breathing exercises, and breathing exercises key. And there's a lot of research on that now. The importance of breathing, alternate nostril breathing, things like that.
I guess making it fun or understanding for the kid as well is probably helpful. Like you said, just sitting there and focus. I know with my 5-year-old and 3-year-old, we do some of the yoga practices, certain movements, and they find that quite fun actually. So adopting that and then adding the meditation afterwards, I found that being quite a helpful strategy if they understand it a bit better.
Yeah.
So really lifestyle and sort of these kind of changes is something that can help them manage the condition so much better.
Mm-hmm. Absolutely.
Yeah, 100% agree.
We have another question, actually. Someone is asking if you could talk a little bit about, ADD and ADHD through a lens of strength. So, what are the strengths that this condition can bring to someone? As an example, the attendee is saying, for example, someone who's very hyperactive but is incredibly creative at the same time. Because I know, Dr. Sherry, you also mentioned it a few times, that it's not necessarily all bad condition, that there can be very beautiful, positive things coming out of it as well. So perhaps you can share some examples, some stories.
My experience has been with the creativity piece of it as a strength. Really, different types of creativity, whether it's artistry of dance or painting or writing, highly creative people. And that's, also the energy or the curiosity, intellectual curiosity is a strength. And I have found this to be the case with people with attention deficits, is that they are eager to learn about the world. They're very interested and they're curious about the world around them. And they want to develop skills. They want to learn new things. They have a vibrancy that is wonderful and should be embraced. And there are free online character strengths tests that you can take. One of them is for kids. It's the VIA Youth Inventory, and it's free and it's fun for kids to do. I think you have to be 9 or 10 to start it, but it's really insightful for kids to understand what their signature character strengths might be. And that's a great conversation starter for you to have with your child. But what do you think your strengths are? What are your passions also? What makes you feel like you're special or makes you feel like you're in control? When do you feel like you're most vibrant, but also, challenged? So, these are all great ways to have conversations about your child and what makes your child unique.
Oh, that's a beautiful way to look at it. Absolutely.
Yeah, we in the UK, it's very similar in the sense the artistic side, talent side, we see a lot of the time where in that 11 to 13, 14, where they're kind of doing all the different subjects, they're medicated. They then go to A level and do art, and they're asking, can I stop my medication? Because it's actually suppressing me. Teachers are noticing it. They're noticing it's not working as well. And even when it comes to kind of even comedy, we have a lot of comedians in this country who actually do have ADHD or were diagnosed late. And I don't think they would have been picked up or they wouldn't have shown their true colors. They needed that ADHD, and they actually say they don't want to be medicated because the true beauty of the talent they have is only shown with this. If you actually dull it down in a way, almost compress it, it's not always helpful. So I think, the artistic side is a true success. Sometimes even doing more than one project at once. Some of these ADHD kids, they're kind of taking on about 5, 6, 7 projects. You just think it's amazing how they do it, but they are able to. They can grab and think of so many things. So they need to embrace it and appreciate the talent they have.
The other area is athletics, of course, and sports. Yeah. And you see this also with, thrill seeker sports, but not all athletes and not all great sports lend themselves well to people with attention deficits because the practice involved is very boring. So there was a big study of this about 30 years ago on who are the thrill seekers. And it's not particularly who you might think. But, when I think of a thrill seeker, I think of, Mr. Branson over there in Virgin Atlantic. Okay. That's one of them, or, people that are, top flight downhill skiers, things like that. But when you look like at speed skaters, that requires a lot of focus and monotony of skating round and round and round. And so that doesn't lend itself to somebody who has an attention problem per se.
So we have another question from a mom who is saying that her son was diagnosed 2 years ago with ADHD, but he is not treated in any way. No therapy, no coaching, no medication. She feels that they should try medication, but her husband is not very keen on that. So clearly there's an issue there. And she's just asking, how would you start the treatment? Would you go straight to medication? Would you start coaching? Who would be the person to ask for the different routes available in the first steps? Would it be more appropriate to go to a psychiatrist or a child psychologist or the GP? Dr. Lavan, I guess it's more for you. And she's basically saying, look, for the NHS services, as you rightly pointed out, the waiting list is enormous and her son is 15. So what would be another route that she could take to at least start exploring some of the different availabilities for her?
Yeah, I mean, there's definitely groups, ADHD groups, as well as psychologists who they're free on the NHS. They're definitely worth as a good starting point. Your GP should be able to direct to services there. We also have a concept known as social prescribing now, which is where the non-medical approach, appreciating not everything is medication related. It could be stress related, employment related, finance related. And they're a good group who are in tap with the voluntary sector in the communities around us. So even for ADHD, we just recently found out about a club for young ADHD kids where they play with trains, but they do very good fun techniques that are really good for the future. So getting in touch with a GP to then find out the link work is a great start. I guess really with the difficulty, and I struggle with this every day, working a little bit private as well as doing NHS, is I've always been, my dad's a GP who's been for the NHS for 40 years. We're very, very NHS loving, always will carry it, always will lift it. But it is getting to that very difficult stage where, we're living longer. There's lots more conditions. We are genuinely struggling. Waiting list for the first time in the UK now for cancer, for example, used to be diagnosed, seen and sorted within 2 weeks. We're getting those 3 or 4 week cases now, which is really sad. So I think in this case, if the affordability is there, and it is a difficult call to make, and Dr. Sherry may share wisdom in terms of what happens in America with costing, but in this country, I do feel if it's something where the waiting list is manageable, fine, NHS is the way to go. But I think something like ADHD, which potentially every month or every 3 months or every 6 months we are waiting, it can actually be a detrimental effect on the child. And therefore seeing that person, maybe paying for that initial consultation and potentially trialing a small medication with psychological support, if you can get that day to night or night to day effect, it will be worth it. You look back. So I see a lot of mothers, when I speak to them, they say, it was difficult to fund that initial appointment, but thank God I did, because of that first initial consultation with a good consultant, a nice follow-up. We are seeing a completely different world, and they would have paid double or triple that money. So I'm not promoting private care anyway. I firmly believe in the NHS, but maybe for that first initial consultation, if there's a difficulty where husband and wife are having different thoughts on it, actually getting into a room with an expert who will actually maybe explain it in very good detail. And I think what Dr. Sherry and myself, what we were trying to bring today is those examples. We're not just reading out of a textbook. This is real life examples where we experience day in, day out, where we see these patients who have gone to a place where they've struggled throughout their first few years of life. And now, because of psychological therapies as well as medication, they are now in a place where they are truly, truly grateful, to the point I get parents literally crying to us, going, my consultant colleague, Dr. Thurman, what a love, he's like a god to us, that one. And he, I know him on a personal level. He's nothing special, but he's obviously sat down and spent the time. So I would encourage, if there's difficulties reaching those in the voluntary / general practice care, it is worth that one consultation, going privately to get an opinion.
I would agree. And I know it's difficult when you have parents who disagree. And in those cases, I recommend speaking to the pediatrician or speaking to the GP, a medical doctor who can explain the research, explain how medications work, why there's medication. I think, when there's a medical professional, that it's also less stigmatizing to go see someone. People are more in agreement because it is biological. It's not just a matter of pulling yourself up by the bootstraps. And I think, it's particularly important for a 15-year-old because one should know how their learning is being affected by ADD before they not only go to university, but how it might be affecting their A levels if they can't concentrate for that intense period of time. So you're actually, as a parent, your own discomfort with a label of ADD might be keeping your child from reaching their potential, and that's very sad.
Thank you so much. Yeah, thank you so much for that. And as we are approaching 8 o'clock and there are no more questions, just wanted to ask if you have any final remarks, any final advice for parents who are either already, knowingly having kids with ADD, or who maybe have an intuition that they might do. Anything else you would like to share?
I think from my side, we're here to raise awareness, and particularly in this country, you know, this idea, you know, you can look on our NHS website, and they've got a wonderful website on ADHD. They clearly say the symptoms. I looked at it just before, actually: inattentiveness, hyperactivity. And I would even go as far as say, if you are suspicious, write those down and just tick it for each thing. Oh, I think he, and then bring that over to your GP, make our life easier and say, look, this is why I'm concerned. They do fit in. We may not always agree, but we will at least go to the next step and say, you know what, there's enough there to go on, because it's our rightful duty. Morally, as doctors, we need to do that. But do reach out, do look at these things. This kind of Google idea is, you know, silly when you kind of just go out in the wilderness and look for anything. If you have an intuition, there's something there. Do a tick box yourself, bring that to your family physician and get that support. And if you're not getting that traction, remember, it's your child at the end of the day, whether it's NHS or England. I know for my child, I'll go, you know, far and beyond to get that sorted. So if it then means reaching out to someone different, a pediatrician, paying for a psychiatrist, do whatever it takes, because I can tell you the reason I do this work now is because it's so fulfilling when you see the other end of it, of what they can achieve from where they were. It's a lovely thing to watch as a doctor, and I can imagine as a parent must be such a lovely thing.
I totally agree. Just trust your instincts as a parent. If you think that there's something wrong, please don't delay in going to your physician. Get the help that your child so deserves, and also put your mind at ease, because you have help and support. There's different online organizations. One is CHADD, CHADD, and they have great resources for parents, just about how to start the conversation, maybe with your parenting partner, or what to ask your physician. I love the idea. Yes, make a tick box of everything that you see. Ask your teachers also for feedback on what's going on. I think I need to come over and volunteer for the NHS. What do you think?
Sounds like
it. We need you desperately.
We don't have that long of a waiting list in the United States. You can always come to see me in Connecticut.
We'll send it over to you.
There you go. Well, thank you both so much. It's been incredibly insightful, and thank you for sharing your views and for giving everyone some tips. And I'm sure we'll pick up on this topic soon enough again.
Thank you so much. And follow up, go to the Meaningful Past website to get more information about parenting, mindfulness, learning, meditation. It's a great resource.
Absolutely.
Thank you so much.
Have a wonderful evening.
Thank you.
Bye.
Take care.
Bye.